All right, looks like we're all here. Good morning, everyone. I want to welcome you to the Makah EOC public briefing for October 12th, 2021. Dr. Cope, if you would go ahead and get us started.
All right, good morning. Thank you, Chief Brenner, and thank you to everyone for being on the call. I'm Dr. Libby Cope, the Health Director at Sophie Charter Indian Health Center and the Health Officer for the Makah Tribe. I will go ahead and share my screen here. Okay. All right. At this time, and I recognize and see very clearly that the date is not updated, but I just updated these slides this morning. We do have 6, and now we've actually just heard about a 7th new active case in Mia Bay. So that brings us up to 123 cases total, and we have now 11 households in quarantine. So just between finishing these slides and now we've got a new active case, and there will be more info about that sent out on the regroup. We do have 14 individuals who are in the same household with someone who has tested positive. And that just helps us kind of predict what's going to happen in the next coming weeks. We have seen an increase in protection for household members. So where household members are vaccinated and where they are taking precautions and wearing masks, and quite possibly have been exposed to COVID in the past, we are seeing a smaller percentage of individuals who are in the same household becoming positive. So I don't actually anticipate that all 14 of these individuals will become positive in the next 2 weeks, just based on our current trend. This graph just shows the cases that we have had each month since March 2020. We've had now 8, including the new case. I was able to update this slide. We've had 8 total for October so far. It's October 12th. So that rate is way lower than it was both in August and September for us. And our projection based on what's going on here and in Column County and Washington State in general, I do not anticipate us to have as many cases as we have had the last 2 months. In the last 2 weeks, we've had 15 total cases. A large majority of those cases are in the age group of 0 to 11. Next largest is in 18 to 34. And so, of course, those are a larger range, but by and large, if you group our ages 0 to 17, that definitely accounts for most of the cases. So that is certainly interesting and makes sense given the rates of vaccination in that younger age group. We've had 2 vaccine breakthroughs in the last 2 weeks. So again, over those 15 cases, 2 of those individuals had been fully vaccinated, 2 were partially vaccinated, and 11 were unvaccinated. One of the vaccine breakthroughs was a Johnson & Johnson vaccine. The other one was a Pfizer vaccine. This data has not been updated, although it has increased slowly. So at this time and as of last week, we still have over 80% of our population 12 and up fully vaccinated. And then 84.5%, population 12 and up is partially vaccinated. And my apologies for not getting this update. The staff involved have had some personal things going on this week. But I do know that we've had more vaccines. Clallam County continues to be high risk. However, their percent positive has decreased quite a bit. So a couple of weeks ago, it was up to 21%. It's down to 11. That is still incredibly high, and I want to maintain that perspective. But thankfully, it is decreasing, which is good. They do have 8 current hospitalizations, which is a slight bump. They had gone down a bit last week and have gone back up. We've had 53 total fatalities in Clallam County, and the rate per 100,000 is at 553. That metric, anything above 75 is considered high risk. So this is just a graph showing that decrease we've experienced in Clallam County. Washington State is more slowly decreasing. It was anticipated and predicted that Column County would peak before Washington State just because they had such a rapid acceleration of cases earlier in September. The United States is also, as a whole, experiencing a decrease in cases, still a plateau around the deaths over here, which is what we expect. So I want to go into some information about the vaccines. I've gotten some questions and continuing confusion around the booster versus the third dose, and that is completely understandable. I will say I've even witnessed health professionals struggle with understanding this. And I think a lot of it has to do with language, which, to be quite honest, doesn't entirely make sense, but I'll do my best to make it as clear as possible. So a booster shot is a shot for people whose immune response may have weakened over time. So the thing that I could think about that might be relatable would be the tetanus booster. So that is something that is recommended over a certain period of time, after just assuming that the body's response to the original tetanus shot will wane and those antibodies may not be as strong over a period of years. And so it's recommended to get a tetanus booster every set number of years. A third dose, and this is unique to COVID, is something that is recommended for people who are anticipated to not have had a strong enough response to the first 2 doses. So for anyone whose immune system is compromised or weakened, really for any reason, they could be recommended to get a third dose. And that's just assuming that those first 2 doses in a healthy person would create a larger response. In a less healthy person will create a weakened response. And then that third dose could help bolster that response to a level that would be close to what the quote unquote healthier person's response would be. So right now, the booster shot, specifically the Pfizer booster shot, is approved. The third dose for both Pfizer and Moderna is approved. And Johnson & Johnson is not approved for either. Now, the dose is the same for the booster and the first, second, and third doses. Like the actual physical material that is being injected in the shot is the exact same. So what's the difference? And I've seen lots of articles trying to explain why are they even using different language for this. Ultimately, the difference is chalked up to the reason for giving it. And I'm not sure I entirely even agree with some of those articles because really the reason that we're giving these vaccines is to prevent serious illness and death from COVID. And then of course, transmission leading to that. But the ultimate impact is the same: increased protection against COVID, increased protection against hospitalization and death from COVID. So I hope that helps. I know there's a lot of confusion out there, and I can't, certainly none of us can change what the media is covering and how they're covering it. But I want to make that as clear as possible. In other vaccine news, the FDA is scheduled to discuss Pfizer use for ages 5 to 11 on October 26th. And that will be an entirely different product. I don't have the exact dosage yet, but it'll be Pfizer brand. It'll be what they've tested, but it'll be packaged and labeled differently than the other adult doses that we've been using of Pfizer. So we're anticipating that and getting ready for ordering it and having it here for our younger community members. Later this week, the FDA committees on the vaccines are going to meet to talk about Moderna and Johnson & Johnson for the booster shots of those 2. And then we should know also more by the end of this month about being able to mix vaccines. So people who had J&J, can they get Moderna or Pfizer or vice versa? More vaccine news. So flu season is upon us. And as has been the case throughout the COVID pandemic, we really don't want both a flu outbreak on top of any COVID outbreak. So we have all of our flu vaccines here at Sophie Tredovic Indian Health Center. We will be having 2 daytime flu vaccine clinics on Tuesdays, October 19th and October 26th. Those will be from 9 a.m. to 5 p.m. at the community gym. It'll be walkthrough. However, we will be able to meet those who are unable to walk through the gym out at their cars. So we will have someone stationed out at the front so that they can recognize when somebody needs to get the shot in their car. Otherwise, it'll be walkthrough, and the setup will be very similar to our COVID vaccine drives that we had earlier this year. We will also be having 2 evening flu vaccine clinics for those who have a hard time getting away during the day. And those will be on Wednesdays, October 20th and 27th from 5 p.m. to 7 p.m. also at the community gym. I'm sure many of you have seen on the news that there is Merck, as a pharmaceutical company, is seeking EUA, which stands for Emergency Use Authorization, for an antiviral pill called molnupiravir. This is something that is thought to be easier, less expensive than the monoclonal antibody therapy. It's 1 pill that a patient would be instructed to take twice a day for 5 days. It reduces the risk of hospitalization and death by 50% in the initial clinical trials. Those have not been peer reviewed yet. It works as an antiviral by inhibiting the virus from replicating. And specifically because of that way that it works, it was not tested on pregnant women. In fact, everyone in the trials had to have a negative pregnancy test, any of the women involved, and were just kind of monitored in terms of preventing any pregnancy. And so it will not be approved for pregnant women because of the risk of birth defects, just because of how that antiviral works. And the trials were only done on unvaccinated individuals. So we don't know yet if it will be approved or used on anyone who's already been vaccinated. And then an update on our drive-through COVID testing at STIC. So we have drive-through testing on Thursday this week from 1 to 3 p.m. and that's at the community hall. Next week, it will be on Monday, also 1 to 3 p.m. And after that, we are going down to just Mondays until further notice. If we start to have an increase in cases again and the drive-through makes more sense, then we'll go back to Mondays and Thursdays. But otherwise, this Thursday will be the last one for now. Any time that a test is needed outside of those days, just call the clinic at 2233 and we can make an appointment for you to come in and get tested. So testing is available Monday through Friday, but for our larger drive-through clinics, we're going to go down to just Mondays. And that's it. I'll just stop for questions.
Thank you, Dr. Cope. That was a lot of information, and thank you for doing all the research and getting all that out to the public. It's very much appreciated. So we'll move into Patty for organization update.
Good morning, everybody. Some information is that the immunization mandate is still in effect for the tribal organization. So the first deadline for employees to submit theirs is tomorrow, October 13th, and that's for the frontline essential employees. Because of the mandate, Human Resources is having to do a new temporary employment roster. So people will have to reapply and provide proof of vaccination if they want to work for the organization. We're still working on small business applications. We've been slowly getting them approved. We've been having to request further information from a lot of the businesses. There will possibly be a community meeting next week on the 20th at 6 o'clock, a council meeting with the community, and hopefully I'll get more information on that out today and get it confirmed. That's all I have, unless there's any questions.
All right, thank you, Patty. Appreciate the update. Move on to the Makah EOC report. Just a reminder, we are still in phase 2. We will have a mask and hand sanitizer distribution set for the 27th of this month at the Village Market, 12 to 4. If that changes, we'll definitely put that out next week or any modifications to that. I wanted to remind everybody to please sign up for the regroup emergency messaging at stick.org. Also, continue to check the stick.org website. Sorry, there was technical error over the weekend, so we didn't get to update some information, but I believe we're back online now. I will confirm that and make sure that everything is updated. Along with this message, the current information that Dr. Cope put out, all of that will be updated and put on the stick.org website. And I believe that's all the notifications I have for right now. So I don't see any questions posed. I wanted to thank everybody. Thank
I
you.
have my hand raised.
Betsy has her hand.
Oh, I see you, Betsy. Go ahead.
Thank you, Jasper. I chatted in there, thank you, but I still believe that I want to say a couple words to our Makah EOC. I want to thank you all for your commitment and for your ability to understand the situation we're in and the need to take steps to protect our tribe. I think you've done a superior job. I think the results show. And I just wanted to offer you some encouragement and thanks and gratitude for standing up there and doing such a good job for 16 or 18 months here. I know it's in my training that Makahs should always strive to be number one. And I can't think of any better response than our Makah EOC. You've proved true to our calling to be number one in leaders. And I commend you all. So thank you.
If I could just say, Betsy, thank you for that. I really appreciate it. Where I got my teaching was from the best mentor I could have, and that was you. And I thank you for your many years of service to the Makah community.
Absolutely. Thank you very much, Betsy. It's very much appreciated. Your leadership, before you stepped down and stepped away from the duties is very much appreciated. It's very lasting. To the rest of the Makah EOC and everybody in attendance, it's all our jobs to keep everybody safe, and we appreciate your support in everything that we do. So thank you guys. We'll go ahead and wrap it up. I'd like to thank the STIC staff, STIC EOC, the Makah EOC, all the management that's involved, everybody who participates. Thank you. Your support is greatly appreciated. It means a lot to everybody because this is a hard job that we're all facing, and it's a hard event that we're all going through, and we're going to continue to do it for a while longer, but we can make it through it. And I want everybody to keep their heads up, and thank you. Thank you. Thank you. Thank you to the Makah Tribal Council for their support and all the efforts that we do. We know we have a tough job ahead of us, and we've done a very tough job, and I hope we've done it to the best of our abilities. So thank you guys for participating. We'll see you next week, and have a great week and stay safe. Thank you.
Thank you.